Hi guys, welcome back to our channel. So, I booked this holiday months ago,
Months ago, yeah.
and we've been looking forward to it, but absolutely ages. Also booked a few more holidays up as well for the rest of the year. And while we're sitting here in Barbados, we might as well, the reason why we started our channel, well, it's not the reason, it's just like a funny coincidence why we've started the channel, and why we're going to keep going. Yeah.
Yeah,
I'll hand you over to Rob.
So hi guys, yeah, we started the channel in March when we went to Tenerife, and when I was there in March, I had a bit of an earache. I didn't think anything of it. I went to the doctors, and my gland was a bit up on my neck. So I got back. He did some tests, and everything turned out fine with that. I had a CT scan on my neck, and everything was fine.
Did you have an ultrasound as well?
Ultrasound. I mean, yeah, ultrasound on my neck, and everything was fine. But he took a set of bloods, and they all turned out okay, just about anyway. But then he also took a PSA test. So I didn't really know much about it.
What is a PSA test for?
Yeah, that's for it's checking for prostate cancer. It's an early stage of checking. So I didn't really think anything about it. So he took this test, and the results came back a couple of days later. And I had a score of 3.9. So then it's like slightly abnormal, because anywhere below over 3 is abnormal.
For your age? Because how old are you?
I'm 53. So again, I thought, I looked at it, 3.9, yeah, that.
We didn't think anything of it at all. We just thought, we didn't know anything. I mean, we've seen the adverts on the TV. I'd said to Rob a few times, go and get tested, but we didn't really, we just didn't know anything, did we?
No, so I thought everything was okay. He said, but I had to come back for another test in 4 weeks later, just to confirm it. So that now takes us to end of April. I got my second test done, and it came back as 4.2. Again, I thought, yeah, that's not too bad. It's only just over 3, and what I was reading about all this prostate cancer at the time was, yeah, it's about a 10% chance because it's so low. I thought, I've not got anything. I'm fine. And I was then started googling people who have got it, and read about Chris Hoy. His PSA turned in at 600. Poor Chris, yeah, he has a stage 4 terminal cancer. And I thought, well, shit, well, I'm nowhere, nothing's wrong with me. I've got 4. I'm 4. What can happen?
Over 4, once you get over 4, then you've got 25, between 4 and 10 on your PSA score, you've got 25% of having cancer. Now, if you're, it's all to do with ages, really. So 50 to 60 should be on a certain amount, 60 to 70 to 80. So Rob was at 4.2.
So yeah, so the booked me to see a specialist, a urologist. So that was booked in, and yeah, it was like a 4-week wait, and it was like, okay, I'm on a 2-week pathway here. Have I got, what's up with me? So I rang up, and I managed to get into a bit earlier. So I waited just over about 3 weeks, wasn't it? I think.
It was about 3 weeks, and we're under Stamford in Lincolnshire, and the urologist Rob saw was Dr. Jyoti Shah, who is one of the leading urologists. Got an MBE, so we thought, yeah, we're okay there. So it literally,
yeah. So yeah. Still not thinking anything of it at the time. So I went in. So the first thing she did, I got a digit test where
DRE.
Yeah, a digit test.
Sorry.
Finger up the bum.
A DRE.
Yeah, finger up the bum.
Those who want to be correct, digital rectal examination.
Yeah, digit test. That was people like, yeah, finger up the bum, and there she felt something on the left-hand side of my prostate. It wasn't enlarged, nothing else, just my left-hand side of my prostate. And so that's when, oh shit, this is getting serious. So
that was on the
it was on a Thursday morning.
and
So I went for the that day, then to go for an MRI scan.
that day.
So at 11 o'clock, I'm getting a full MRI scan. So checked out there, got the MRI scan, went home, and she's going to contact me next week. Saturday morning, this was bank holiday weekend, spring bank holiday weekend.
This was 2 days later.
2 days later, she contacted me, rang me up, and said, "Oh, nothing to worry about, but I'm contacting you today." Well, it's bank holiday Saturday. Of course, there's a bit to worry about because why else phone me on a bank holiday? She said, "Oh, can you come in on Wednesday for a chat about your results?" Okay, so
so off we toddled to Stamford, and we sat in the waiting room.
Off we took, to Stamford, sat in this waiting room.
And I must admit, Rob was like the youngest one in there by at least 20 years. It was quite sobering, to be honest with you. And there was...
I mean, the MRA scan did put up as it came up as a type 3A...
Stage 3A, PRADS 5.
Right, aggressive cancer. And that's what it came up on this score. And so I went and saw her, and I said, just to check things out, I needed a bone scan.
No, you had your biopsy first.
Oh yes, I came in for a biopsy. So I came in to see her, have a chat, and
we sat there with all these men
and gave me a biopsy. Guys,
that was. Be honest. You might as well be real.
I'll be real.
Real.
It is not pleasant.
Leave your dignity at the door.
Talk about violation. Yep, it's like somebody sticking a big spiky prong up your bum with a staple gun on the end of it.
But what was it like? What did you have? You had anaesthetic as well?
I couldn't tell you.
You was in and out within about 5 minutes.
Yeah, so it's basically a big steel, big prong with a staple gun on the end of it. That's what it felt like. And she took 12 specimens, 8 on the left-hand side. Bang, bang, bang. Yeah. Oh, yeah. You feel every one, and then 4 on the right. So.
Don't scare people.
Well, what do you mean don't scare people? That's the truth. And I said I'm a biopsy, and then she booked me in for a bone scan. And
by this time we were starting to think,
oh shit!
Oh my god! So we hadn't got the biopsy results by then. That they took a couple of weeks.
Yes, a couple of weeks. So
bone scan.
So a bone scan. I went for the bone scan. Yep, just sat there 15 minutes. Bone scan. Thought nothing else of it. The results came back, and I had
really quick.
Really quick. I had something on my left-hand side here in my jaw, which could be dental or could be my sinuses, where I had my problem.
No, you had a sinus, sphenoid sinus problem, a problem here in the jaw, problem on the rib and pubic symphysis, undetermined on rib as well.
It was undetermined on rib, probably benign. So yes, probably benign. So part of the staging of the prostate, all the doctors get together, have a chit chat, and decide
it's called an MDT, multidisciplinary term, and they discuss all your results totally. So there's radiologists, oncologists, there's lots of different people, and they give you a Gleason score
and find your treatment going forward. So Thursday before we went on holiday, we went back to see her.
We're sitting there, aren't we? And there was like literally man, husband and wife, husband and wife, husband and wife, a couple of guys on their own or whatever.
So in we go, and all started well. She said, no need for introductions because we've met intimately already. Obviously had, because she's been there and done the biz.
That's a biopsy, by the way.
Put the biopsy, and
it comes as no surprise.
And it comes as no surprise. You've got the stage 3A.
Stage 3A, guys. So just to give you a bit of context, okay, because I think it's really important. So you've got stage 1, 2, 3, and 4. Stage 1 and 2 is confined to the prostate, and that's probably the lesser of the, that's the lesser of the evils. None of it's nice. Stage 3 is where it's more aggressive. And stage 3A is where it's
It's breaking out the prostate,
It's broken outside of the prostate gland,
but nowhere else.
but not gone into the seminal vesicles or
Yeah.
vesicles or the lymph nodes. Okay, so we thought. So the oncologist said,
Basically, I've got a sugar cube. I've got a growth the size of a sugar cube at the side of my prostate. That is basically what I've got. That's the easiest way to explain it. It's not gone anywhere else. We don't know, but we're not going anywhere else. So then said, well, that was the good news. I knew that. I accepted that.
And so we just sat there and we thought, okay, that's an operation, maybe a bit of radiation, we can get through that, and then PSA testing for life. We know we're okay. And then she said, but she wasn't happy with my rib. It may have spread to my rib. She didn't know. So and that means if it spreads to my rib, that's stage 4 cancer. And there's no operation, it's chemo and containment. It's basically if we get stage 3A, then it will be a prostatectomy and radiation. Stage 4, she was really she cut to the quick. She wasn't going to mess around with us because she knew we were sort of people that were, okay, we just want it, don't sugarcoat it. And stage 4, I'm sure a lot of you know out there, we probably had so many family members affected by cancer and that kind of thing. Stage 4, it will be chemotherapy. It's incurable. And so then she said
she wants to give me another PET scan. It's a posh PET scan. I don't know what it's called.
Okay, it's called a PSMA. So that's prostate specific antigen something or other scan. So this scan is specifically to test the PSA and cancer or something like that within your body. It's a really, really specialised scan. Not many hospitals actually have the equipment, so we can't go to our local. We can't go to Stamford or Peterborough. We have to go further afield, either to Edinburgh, Northampton or Leicester.
We're going to Northampton.
We're going to Northampton. So this PSMA scan is going to tell us whether it's going to do the whole body, and it's going to tell us where cancer is, if it is anywhere,
it's basically,
and especially the rib.
We're at the stage now. This PSA, hopefully it's going to tell. I'm going on Wednesday, by the way. It's only
this next Wednesday. So we're on the 29th of June. We're going on the
2nd of July. And this is where we are at the moment. So we don't know if I am knackered or mega knackered.
Yeah,
if I've got stage 3A or I've got stage 4. That is can they cure me or can't they cure me is the option at the moment.
I think
it's getting a bit scary. It's getting a bit real now. And all I want to say is, guys, get yourself checked out, especially if your dad, granddad, brother has had prostate cancer.
Ask your family history.
Ask your family history. And also, if your sister,
as well,
mother has had breast cancer. And there's a gene out there that affects females with breast cancer and males with
genetic
prostate
testing.
Cancer. Get it. Just get yourself PSA tested.
Get yourself tested. If there is a higher risk, then at 40 you should be being tested. Okay, but please, guys, as Rob says, if you have brothers, fathers, uncles, grandfathers that had prostate cancer, get yourself tested. You can, on the NHS, get yourself tested.
Yeah, I mean, I may be very lucky and only have stage 3A. That's what we're hoping at the moment. And if I got tested when I should have got tested
at 40,
at 50, no, I just might have missed it because my PSA is very, very low. So I'd have gone, yeah, I'm fine, and I wouldn't have got tested for 5 years. That's what most blokes are like. That's what I'm like.
And you'd have definitely been stage 4 by then because you've gone up 0.3 in 3 weeks or 4 weeks, and over a whole year, that's literally doubling a PSA.
Yeah. So I would have, I might have got tested. I might have been 2 last year, and get yourself tested. And if you slightly think you're at risk, get yourself tested every year. Don't worry about it. Just do it. It's a serious thing. I mean, hopefully I'm going to be lucky. And I'm going to vlog you through this anyway. My history, not my history, but I
think it's really important for people to get the message out there.
Yeah.
Guys, it's so important. Please get yourself tested. It's just a blood test. I'll be honest with you. I didn't know much about prostate cancer. Didn't know anything PSA level, nothing until Rob came home and told me that he's got to have a. I didn't know any of it. I did not know any of it. And to catch these things earlier while it's still contained, you have more choices.
What I also must say, I've got no symptoms.
Yeah, he's got
zero symptoms, and so there's no way of knowing. I've got zero symptoms of it. If I did have symptoms, if it's too late, I'm presuming. But yeah, I'm gonna blog my journey and experiences now.
But
from when they come.
Yeah, talking about symptoms though, I mean, symptoms to do with prostate cancer, I guess, are getting up at night, going to the toilet a few times, isn't it? That kind of thing.
That's more the enlarged side of the prostate cancer.
Oh.
If it's enlarged prostate as well, you see.
Yeah, because some people have prostate cancer and they literally have it for years and years and years, and it doesn't affect them at all. They're probably going to die with it.
Most men die with it.
So for people who are trying to support their other halves that have been diagnosed with cancer, in fact any cancer, do you know what? It's really tough.
I mean,
I'm still in the shock stage. I can't really fathom it. I can't understand it. I mean, he's only 53. Well, he's got stage 3A at 53.
I mean, yeah, basically, what I'm trying to say is that, this is my journey through it, and if also you're feeling suffering and wanting some support, just get in touch and we'll get together and, have a chat online or wherever. It's a strange thing. It's a hard thing at this age to accept you're having it, and
you start feeling things about life and what you're doing, and I mean, it's for us, it's like changing our life. And we come on holiday to Barbados and we've literally tried to show, we just like kept ourselves busy. I think if we just sat on the beach and did nothing,
I think we'd gone mental.
You'd have been really well. But Rob's really doing well. I mean, he's not, I don't know whether it's really sunk in yet. I think until we get the next scan out the way.
I mean, whatever is good, bad, or not, is bad or very bad. But I'm treating the bad as good at the moment.
Yeah, and bad is good.
Yeah, I mean, she said I definitely got 3A, stage 3A. That's a definite, and it's whether I've got 4 or not is the question. It all depends on the little 7th rib on the left-hand side. But yeah, it's just just get in touch, and we're just trying to.
We're trying to work through this ourselves. So. Yeah, so Rob's good. He's made the decision to vlog this on YouTube. It was his own decision. It wasn't mine.
I don't have the answers. I don't. I have lots of questions. I don't have many answers.
If it can help just one person, if it can help one guy, if it just can help that one person see, oh my God, yeah, you're 53 and you've got yourself tested. And look what's happened. I
mean, I was tested by accident.
Yeah, tested by accident. So be proactive. That's all.
Yeah, just get them. But then, if I got tested 6 months ago, a year ago, I'd have just forgotten about it. But yeah, if you think you're at risk in a risk group, get yourself tested more often, and don't just bury your head in the sand.
And don't be fobbed off.
Yeah.
Push for these tests. Definitely.
They're easy tests to do. Just push for them. It's non-invasive. It's just a blood test. To start with, but push for it. And if it's just 3 point something, push for another test.
Yeah, if you're in your 50s and it's slightly raised, then go back for another one, even if it's like a month or 3 months later. Go on what your doctor decides. Then be proactive yourself, definitely.
Unfortunately, I had a good GP who noticed it, but if the GP didn't notice it, it could have gone and said, 3.9, that would be fine, So yeah, just push for it and just be aware, guys. Be aware.
It's so important. So that is the first log on the prostate cancer journey.
And I will put some information bits out there on my on the details below. Yeah, but please please follow me on this. And if you've got any questions and want some support yourself, just please get in touch. This is about
helping everybody out there, helping men out there.
Helping everybody on my journey, yeah. It's partly personal journey, and it's just also meant to help other people.
And also it's a good therapy thing for all to be able to get his side of his story out there.
Because I'm an old bloke, and I don't...
You're not old.
I'm normal, I said, a normal bloke.
This is an old bloke.
I'm just a normal bloke, and I just... I don't get my feelings out. Apparently, I don't communicate them to people and things like that.
I think you're still in shock, though.
Yeah. So
I personally think you're still in shock, and you know what, yeah. I mean, all the time since we've known, you've not crumbled.
No. So yeah, just anyway. Good luck,
Yeah,
guys,
so that's our first vlog.
and stay
So
safe.